Hello friends, I am Amit Belekar from Tips and Tricks by AMB. Welcomes you to my channel. Before moving further, if you still didn't subscribe my channel, please click on subscribe button and click on bell icon to get further notifications of all my new videos. Today in this presentation we are going to discuss about one of the important topic in pharmacology and toxicology, and that is pharmacodynamics. In this video we are discussing one of the part of pharmacodynamics, that is principal drug actions. After going through this video, the learner will be able to define pharmacodynamics and describe various principal drug actions. Before moving further, you have to reflect on a question. Pause the video, think on this question. What changes you expect in cell, tissue or organ activity after the entry of drug in it? Think and write your answer in notebook. Then play the video. You will get the answer of this question in this video. So let us see what is pharmacodynamics. For understanding pharmacodynamics, we have to ask two questions to ourselves. First question is, what a drug does to the body, or what changes drug does in our body? And second question is, how drug produces these changes in our body? Answers of these questions are as follows. When drug is entered or administered in our body, it produces various physiological and biochemical changes inside our body by utilizing various components of our body. The physiological and biochemical changes which are produced in our body by the drug are called as pharmacological actions of that drug. And the way by which these effects are going to be produced is called as mechanism of action of drug. Thus, pharmacodynamics is the branch of pharmacology which deals with study of pharmacological actions of the drugs and their mechanism of action. So now we are going to discuss which type of effects or pharmacological actions or drug actions can be produced by drug in general. These are nothing but principal drug actions. So whenever drug is administered, drug do not impart or introduce any new function to any system or organ or cell of our body. So drug is not introducing any new function in our body. It only alters the pace or speed of ongoing activity of our body or that organ or that cell or that tissue. It means that it either increases or decreases the activity of cell or activity of tissue or activity of organ or activity of a system of our body. So there are basic types of effects or activities or actions can be produced by drug in our body. These all basic activities are called as principal drug actions. The basic type of drug actions can be broadly classified as: first is stimulation, second is depression, third is irritation, fourth is replacement, fifth is cytotoxic action, sixth is physical action, and seventh is chemical reaction. So any drug, when it is enter in our body, it produces any of these 7 generalized actions which are called as principal drug actions. So let's see these principal drug actions one by one. First, we are going to discuss about stimulation. So what is stimulation? stimulation means selective enhancement or increase in activity of specialized cells, then the present activity is called as stimulation. So in stimulation what happens? There is increase in the activity of specialized cells. Specialized cells like muscular cells or muscular tissue or nervous tissue or neurons. In these specialized cells, their activity, if it is going to be increased, it is called as stimulation. For example, adrenaline stimulates heart and increases heart rate, force of contraction of the heart and tone of cardiac muscles. Here you can see the speed of heartbeat in normal condition, and in presence of adrenaline, if you see the heart rate, it is going to be increased. So adrenaline is increasing the heart rate. That's why we can say that adrenaline stimulates heart and increases heart rate. So that is the stimulation effect. Another example is pilocarpine. It stimulates salivary glands and increases salivary secretions. But excessive stimulation is always followed by depression of that function. So whenever we are going to use stimulant drug, we should keep in mind that excessive stimulation is always followed by depression of that organ or that function. So that we have to keep in mind. Now next principal drug action we have to discuss is depression. So what is depression? It is opposite to the stimulation. So selective decrease in activity of specialized cell is called as depression. So here what happens whenever drug it is administered in that organ, we can see that its function is going to be declined. That is called as depression. For example, we can see barbiturates depresses CNS and slows down the impulse transmission in the brain. So slowing down of the impulses is nothing but the depression, and that is done by barbiturates. Another example is quinine. Quinine depresses the heart. So already we had discussed adrenaline stimulates the heart and increases the heart rate, but quinine depresses the heart and it decreases the heart rate and force of contraction. You can see the speed of heart in absence of quinine and in presence of quinine. In presence of quinine, heart rate it is going to be decreased. So that effect is nothing but depression action on the heart. Next principal drug action is nothing but irritation. So what is irritation? It is a non-selective, noxious, unwanted effect and is particularly applied to less specialized cells like epithelial cells and connective tissue. The two effects we already discussed, that is stimulation and depression. In that case, these are associated with specialized tissues like muscular tissue or nervous tissue, but irritation is associated with less specialized cells or tissues like epithelial tissue or connective tissue. And it is the noxious effect, unwanted effect on that less specialized cell like epithelial tissue or connective tissue. That is called as irritation. Irritation is of two types, with mild irritation and strong irritation. Mild irritation may stimulate associated functions. For example, if bitter substances are administered by oral route, it increases salivary secretions and gastric secretions. So that is called as mild irritation. And strong irritation results into the inflammation, corrosion, necrosis, that is tissue death we can say, and morphological damage to the tissue. Because of strong irritation, there may be loss of function of that organ or tissue. So strong irritation is hazardous to the tissue or organ. For example, we can see strong ammonia is very strong irritant. If you try to inhale or smell strong ammonia, it will strongly irritate and damages nasal mucosa. After that, you cannot able to smell anything for next 2 to 3 days. That much strong irritation can be produced by this strong ammonia solution. It damages nasal mucosa and we cannot smell anything for next 2 to 3 days. That much strong irritation it is produced. So it damages that tissue, mostly the nasal mucosal tissue. It gets damaged and because of that we cannot smell. If you consider mild irritation and strong irritation, mild irritants can be used for therapeutic purpose than the strong irritation. So mild irritants can be used for therapeutic purpose mostly than strong irritant substances, because strong irritants may lead to damage of the tissue. Next principal drug action is replacement. Many times there is defect in individuals and the endogenously released substances which are previously produced in the body, now these are not produced in body of that individual. So there is deficiency of such endogenously released substances like hormones or neurotransmitters. In such deficiency states, we can use hormones or chemicals or natural metabolites to correct the deficiency of these substances. This use of natural metabolites, hormones or their congeners in deficiency state to correct the deficiency is called as replacement action. For example, in Parkinson's disease, there is deficiency of levodopa, and to correct the deficiency of levodopa, for example, in Parkinson's disease, there is deficiency of dopamine in brain, and to correct that deficiency, we take levodopa drug, and this levodopa, when it enters in the brain, it gets converted there into the dopamine and it acts as a replacement for the dopamine. Another example, insulin from pigs or other animals can be used to control insulin dependent diabetes mellitus. Here also we are correcting deficiency of insulin. Another example is iron can be used in the treatment of iron deficiency anemia, where there is deficiency of iron, and because of that RBC production or hemoglobin level in the blood, it is going to be decreased, and to increase that level we are taking iron from external sources. That is called as replacement. So that is about the replacement. Next action is cytotoxic action. Now cytotoxic is the word which came from two words, which cyto means cell and toxic means hazardous. Thus the action of drug, if toxic or hazardous to the cell, it is called as cytotoxic action. Drugs may have selective cytotoxic action for invading parasites or cancer cells and kill them without significantly affecting the host cells for cure of infection or neoplasm. So if we are suffering from infection of any microorganism, we are taking antibiotics, and these antibiotics are killing that particular infectious organism and not our cells. So that is selectivity is there. It selectively kills that microorganism cell or tissue That's why it is called as cytotoxic action. And in cancer also, we are taking the drug to kill that cancerous cells. So that is again the cytotoxic action. So examples of the drugs like antibiotics like penicillin, chloroquine, mebendazole, this can be used in various infectious diseases, and use of cyclophosphamide, which is anti-cancer drug in the treatment of cancer. These drugs are having cytotoxic action. Now next principal drug action is physical action. Some drugs act mechanically because of their physical properties. So here drug is using its physical property to produce the effect. For example, Kaolin is used in the treatment of dysentery because of its absorptive properties. So what Kaolin does? Kaolin adsorbs whatever toxins which are released by bacteria and decreases the effects of dysentery. As toxins are adsorbed on the kaolin, these toxins are not able to produce effects on the intestinal wall, and because of that dysentery can be reduced. So that is how kaolin produce effect in the dysentery. So here kaolin is using its physical property for producing the effect. And last principal drug action is chemical reaction. Some drugs act by their chemical properties or by combining chemically with substances which are already present in the body. So they are chemically reacting with endogenously released substances and produce their effect. For example, we can see inorganic antacids which are neutralizing the gastric acid by chemically reacting with it. Mostly these inorganic antacids are bases in nature, and they are reacting chemically with the acid which is present in the stomach and neutralizing that acid, and thus it produces antacid effect. So that is the chemical reaction action can be produced by drug. So these are the various principal drug actions. Now it is time to summarize. In this video we had discussed about definition of pharmacodynamics, then we had discussed about various principal drug actions like stimulation, depression, irritation, replacement, cytotoxic action, physical action, and chemical reaction. So these are the various principal drug actions we had discussed. Thank you for listening me patiently. If you like this presentation, please click on subscribe button and bell icon to get notifications of further videos. Like it and share it to your dear ones. If you have any queries, write me on my mail address which is given in the video. Thank you once again.